Challenged as always. Okay, we're live on Facebook now. All right, here we go. Good morning, everybody. This is Philly and B Town with Meridian Real Estate, and this is coffee chat time with my friend Stephanie Morup of Morup Wellness. I have a little story to tell. The reason why I'm late is I went to get her a coffee this morning and ended up taking a little too long. It was like 15 minutes. I waited there anyway. I left without a coffee. The poor girl like dropped the coffee she was making, had to redo them, and I was like, okay, I just gotta go. I gotta go. So sorry about the coffee, but
Here we are.
welcome. How are you
I'm
today?
good.
Good. It's I came in hot this morning. I'm like, I'm here. And yeah. So I'm gonna breathe. Whew. So the reason why I wanted you on today is because I think that hormone therapy is something that people are talking about a little bit more, and especially for women, they're afraid to talk about it. I've been working with you probably with the last year now.
I hear ya.
Yeah, and so I thought let's tell the masses what you do, and so I'll let you introduce yourself, give us a little bit of background.
Okay, my name is Stephanie Morup. I'm with Morup Wellness. I've been doing hormones now. We're going on 3 years, maybe.
Okay.
Maybe, yeah, maybe. I've been an orthopedic PA for 21, 23 years.
Wow.
Give or take, with slowly declining as far as how much I do there anymore. I occasionally will still help at the wellness clinic, but it's getting less and less. I have a full team now, which is fantastic. My main specialty at that time was trauma. So now I've kind of veered into the hormone realm, as I just felt it was really not well served in our community.
Right.
I mean, if you live in Chicago, LA, hormone specialists are everywhere. We were just very slow to get on that.
We're behind the times.
Yeah.
We're behind the trends a little
But here we
bit.
are now.
But
We're getting
here
there.
we are.
There's I've noticed just even on if you look up hormones, if you Google it, there are quite a few more places that are coming through. So hopefully we will be able to support the community and get the care that is necessary for everyone.
Awesome.
That's a good thing.
So what inspired you to start the Morup Wellness?
I originally started with Premier Aesthetics, and that venture did not work out, which was fine. It at least steered me to where I am now, and I'm very grateful. I had been approached to do hormones for that particular practice, and so I was very fortunate to get the training. And then in October of last year, GM14 signed a bill that said PAs who had been in practice for so many years, they'd have so many hours, could practice independently. So that kind of what kind of gave me the motivation to say, okay, I know that a lot of doctors are not very comfortable with hormones. And it has to do with our training. It's not, there's nothing wrong with me on hormones. I think it's just got a bad rap due to a flawed study. But because of that, it was going to be difficult probably for me to find a provider at that stage that I felt would be a good team and match for me. So in October of 2023, we were able to open up our own practice.
Nice.
It just was fortunate that was happening at the same time.
And here you are.
And here I am.
And you're downtown. Tell us about the look. It's the Oliver Building, right?
Yes.
Downtown.
We're in the Oliver Building across the street from Wild Ginger on the second floor. And I chose that spot mainly because I didn't want a storefront.
Yeah.
I think a lot of people, when it comes to their care, really don't want to be out on, there's a lot of facilities or clinics that intertwine aesthetics with hormones, and that's fine, but it's not for everybody.
Right.
And so to keep my costs down, I wanted a space that I wasn't going to have a $9,000 building costs. I mean,
overhead.
Yeah. So you're trying your best because hormones are not covered by insurance.
They're not. Yeah.
And so my goal is to try to make it available to patients and try to keep my costs as low as possible.
Make it affordable.
So,
Yeah. So just to give you a little bit of background, I found out more about what you do. I think we were both attending an open house downtown, one of these new lofts, and I don't even know what started the discussion. I think we were talking about weight, and I was just talking to her about how frustrated I was because I'm like, I'm working out all the time and this and that. And I still can't lose the weight. And you were telling me about hormone therapy, which I found very interesting. And so far I've been on, I'm just going to throw it out there. I've been on testosterone, and I found out my thyroid was not working correctly. So I'm on thyroid medication, and I've noticed a big difference. Muscle tone, I sleep better, better energy. And I don't know if this is a side effect, but my mental health is a little bit better. I don't get anxiety as much as
that
I
is
used to.
definitely. Actually, there is a study that was done on thyroid hormone. They use levothyroxine, though, not NP or armour which I prefer. And what they did was they gave patients who had manic bipolar disease large doses of Synthroid, and it improved.
Really?
It improved a lot of their quality of life. It had actually balanced them. And so we do know that hormones have a lot to do with our mental health, depression. But that's just what we do to women.
Yeah.
If you really think of the word hysteria, it was based off of our uterus. And when women became hysterical, the word comes from God, what was that? Greek word, I believe. Don't quote me on that. And what it meant was that our uterus was causing havoc in our body. It was moving around.
Which it does once a month.
And so it's kind of interesting that that's how we were always perceived.
Yeah.
When women have any emotional issues, whether it's based off our hormones or not, we're crazy.
Right.
Here's an antidepressant.
Yeah.
Here's this.
Yeah.
And it's unfortunate because hormones do play a role in our psyche, in our mental health. And I mean, we see it, look at postpartum depression.
Yeah.
I mean, my God, if you're not listening, I don't know what else can be more black and white there, that a woman goes through her massive influx of hormones to have this baby, and then it drops, and she's an utter mess. Right. And what do? We give her antipsychotic drugs.
Yeah.
And so hormones play a big role in our life. And yeah, if that's a side effect, I'm taking that side effect. If it makes me less anxious, if it makes me less fatigued, if I start to not have that feeling of just doom and gloom all the time, I'm taking that side effect over feeling that way. I mean, because really, let's think about it this way. You and I don't have Prozac receptors.
Right.
We don't have Wellbutrin receptors. Why are we not going and making sure that a patient's hormones are in good optimal ranges? Not normal, optimal.
Right.
So that maybe those side effects of not having those hormones can go away, which could be depression and anxiety.
Right. Yeah, well, because you look at I have two they're not teenage. Well, one of them's not a teenager anymore, but when she turned a teenager, you can see the difference, right? When the hormones kick in, they change. Who is this person? They're like an alien, right? That just got dropped into my house. I'm dealing with that with a 12-year-old right now. So, that just proves that hormones do play a major factor in your
look at boys.
Oh yeah, boys too.
They get more aggressive. They get more. Their fight comes in, and so it's not a bad thing for them.
Yeah.
But for us,
women are always like you're crazy.
What's going on here? Lost your mind.
So maybe for people that are watching and they're like, I'm kind of intrigued, I want to learn more. Take us through the process, from when they contact you till they come and visit you. What's kind of the process look like?
So when you contact me, first of all, it's important to understand that perimenopausal state and even hormonal decline can start even in our 30s. Mm-hmm. People think that your postmenopausal or perimenopausal has to be late in our 40s. That's not necessarily true. So some females can start having some symptoms early in their 30s, and this also includes men. In fact, men start to decline, their hormones start to decline. By the age of 30, they start to lose 1 to 2% of their testosterone levels yearly. Wow. And so we're really not supposed to be here. I mean, I'm 53, we should be dead. That's reality. Okay. The life expectancy was a 45-year-old male. He was white and he was rich. And that was the life expectancy back when. And now we have all, we have antibiotics, we have all these things. In fact, you have a heart attack, I'm going to crack open your chest, take some veins from your legs and the mammaries, reconnect you and let you live for another 20 years. Right. But how's the quality of that life? Yeah, that's true. So, so I just want to make sure that people understand the age part there. When you first contact us, you just let me know what you're feeling, how are your symptoms. If we think we can help you, make an appointment. I normally spend about an hour and a half, almost 2 hours per patient.
Mm-hmm.
It is a long appointment because I'm explaining hormones. We're going, if I get your labs prior, which is what we're trying to do now,
Right.
so that when patients come in, they have
Okay.
some actual data that we can go through.
Mm-hmm.
I do an exam. If you don't have labs, I can draw them here. Unfortunately, insurance does not cover labs. And I would say our lab draws full panel first female about $250.
Yeah.
After that, it gets a little more reasonable, $175, because I'm not doing that full panel unless somebody wants to add like the labs that maybe their primary doctor's doing anyway.
Yeah.
We then you come in, you have an exam and a consult, and that's a total of $350.
Mm-hmm.
And so again, insurance doesn't cover. We do take HSA cards, Flex,
Okay.
and I can give you the invoices for that. I don't argue with insurance either, so
Yeah.
that's why I don't take it, because insurance doesn't cover this normally.
And what do you think that is? Is it just because they don't
It's preventative.
know? Okay.
The UK just added hormone replacement therapy onto their formulary for men and women.
Okay.
So the US is behind. It's
Right.
the bottom line. And if you really want me to tell you, I think it's big pharma.
Yeah.
I prefer you sick with diabetes. I want you to get
That's
some
where the
visceral
money is.
fat.
Yeah.
I want you to get hypertension. I want you to get metabolic syndrome. And that doesn't happen to us until we hit our 40s and 50s, when our hormones decline.
Right.
Prior to that, you don't see little kids running around
No.
with hyperlipidemia and hypertension.
Right.
Maybe diabetes, and
Yeah.
unless it's familial high cholesterol, right?
Right.
Where it's a genetic thing. But most of us were pretty darn healthy.
Yeah.
And now with that decline, then you start getting sick, and everyone says it's a natural process of aging. I'm sorry, I'm not
No.
aging naturally. And we can think about it in another way. Natural process of aging. Okay. So why are you treating my hypertension if I want to age natural?
Yeah.
Natural process. That's a natural process.
Right.
Why are you fixing my diabetes? Leave my cholesterol where it is.
Yeah.
If it's 8, when does it stop?
Yeah.
Do I need to fix my teeth anymore? Oh,
Right.
natural process of aging. You know what I mean?
Right.
And so, and that was told to me by a 75-year-old lady. She
Mm.
came and she says, my doctor asked me when I was going to get off my hormones, and I said, never. And I said, well, what did they say? And she said, why don't you age gracefully? And she said, oh, she looked at the doctor. I guess that's what she said. Age gracefully. Well, you didn't let me age gracefully. You put me on blood pressure med when my
Yeah.
blood pressure went up.
Yeah.
You put me on cholesterol medicines when my cholesterol went up. So where is aging gracefully start?
Right.
When does that start? When I start, I'm not aging gracefully because I do Botox. I'm not aging gracefully because I take care of myself. When does that start?
Yeah.
And so
That's
it's a very
good
interesting
point.
process. And I think a lot of it has to do with insurance.
Yeah,
Doesn't want to
totally.
cover it. So it's distressing. I mean, I guarantee you, I probably spent $6,000 before I found the provider
Wow.
that I felt that I was comfortable with,
Yeah.
and it worked out. And that's hard, right?
Right.
All of us are different. Every wellness provider is different, and what we expect from a patient and what a patient expects from us and their goals. And so when you finally mesh, that's fantastic.
Mm-hmm.
But it can take some time to find that provider that you guys are perfect for each other. And until then, you're spending money.
Yeah.
And so
Find the
it
right
can be
one.
very expensive.
Right.
But now looking back, it was worth it, because that put me where I'm here now.
Yeah. Yeah. So once you get, because I've gone through this with you, once you get the labs done, you kind of give that client basically what's the word?
So we come up with a treatment plan.
Treatment.
So you're telling me your symptoms, when did they start, how bad are they, and I like to know, okay, what's the worst symptom for me right now?
Right.
Well, is it weight? Is it not being able to sleep? Are they hot flashes? Is it vaginal dryness? Is it not feeling like you want to be intimate with your spouse?
Right.
And so we go through these things, and then we start to say, okay, this is where your hormone levels are. This is what these hormones will do. And we can start to add them. We can add them all together at once. Or if you would like to do a progressive approach where you start one and then the other.
Yeah.
And I'll always kind of say, look, this one's going to be the best one to start because of these symptoms.
Mm-hmm.
And then add this. But it's definitely a more personalized approach.
Yeah.
And again, accountability. Patients need to be accountable. I'm not here. I can't make you better if you don't put in the work as well. So
and that's a good point. So like, the testosterone and stuff like that, you still have to exercise, you still have to eat, right? And
yeah.
I will admit, the last like 2 months, I have not been eating very good, and I could tell. But the crazy thing is I could still see the muscle tone in my stomach, even though I've gained like 10 pounds. I could still see it. I'm like, it's there. And so like, I gotta get better, So in fact, you have to be accountable.
Yeah.
It's not just a take a pill and you're gonna lose all this weight.
Right, and that's everything, right? The semaglutide craze.
Yeah.
If you're not making your patients accountable, they're gonna lose their lean muscle.
Yeah.
And when it doesn't work, they're gonna be like, well, it doesn't work for me.
Right.
Oh, what are you doing?
Yeah.
You have to put in the work. Arnold Schwarzenegger didn't look like Arnold Schwarzenegger from sitting on his sofa.
Yeah.
He used a lot of hormones, and that's nothing we do. But to say that he didn't put in the work
Right.
and just sat on his bum, that's not gonna work. It doesn't matter what.
Yeah.
Men, women, doesn't matter. You still have to put the work in and keep as clean as possible.
Yeah, and I saw this. I was on TikTok the other day, and this gal, she's on the semaglutide, and she's like, "Yeah, and I usually eat this whole. I mean, it was like fries with cheese sauce on it. I usually eat this whole thing, but now I'm on semaglutide. I only eat a couple bites. I'm like, why are you even eating?
Yeah,
that?
why is that even part of your protocol today?
Like, what are you doing? And so I think maybe that's why you hear, and I don't know much about. We won't go dive deep into that, but the semaglutide, like you hear people get off of it and they get on sweet fat because it's probably because they didn't change their lifestyle, right?
Correct.
So,
And that's everything, like when you come to me, and I've seen this time and time again, I'll have patients and they're at their bottom. They feel like crap. They're depressed. It's a roller coaster. They go to the gym and then they don't see any results. And then next thing you know, they're like, well, why go?
Yeah.
Why not have that pizza
Yeah.
or cake when whatever I do is still not helping me?
Right.
Because they're not getting the results. Well, here's the deal. Without hormones, you're not going to get those results. You're going to get that what we call the
Belly tire,
estrogen or lack thereof estrogen belly. You know what I mean?
Okay, yeah.
Look at men. Man bod? I don't think so. No. And that's lack of testosterone that converts. But then they need to convert to estrogen. And so it's both sides. And we've just made a lot of stigma.
Yeah.
Or pushed a lot of stigma. I don't know if that's even the right way of saying it. There's been stigma placed on hormones based off of really or not very good data.
Right.
And so we really need to start educating patients. Patients need to start educating themselves and really look at the data of what's out there. And here's even the best question that you can ask yourself. How is something bad for me that I made? How is it all of a sudden bad for me?
Yeah.
How is estrogen, progesterone, and I don't use those, okay? I use estradiol and progesterone. So how is estradiol and progesterone bad for me when I was producing it
in your body?
all my life? And we can go a little further. How is it bad for me when you gave me birth control with estrogen and progesterone for over 30 years? And all of a sudden I don't make it, and now it's causing cancer, and now it's bad for me. Come on, we really need to start asking these questions. Yeah. Because the studies prove otherwise. Right. It's proven otherwise. The guidelines that are out there are misconstrued. It just says, it's best if you take hormones within 10 years of you getting in the menopausal state. Okay. People are taking that as saying only 10 years after you've been in menopause, and then you should be off of them. Yeah. No, that's not what the guidelines state. Right. But that's how we're being told. That's how we're being taught. Yeah. And I just think it's just, and I applaud providers who are learning. It's unfortunately medical school, PA school, nurse practitioner school, they don't teach this. And I think there's only one school in Arizona currently that has integrated wellness into their program. So we're getting there, but that's one medical school of how many? Yeah. Yeah. There doesn't seem to be a big emphasis on preventative, right? It's always like fixing the problem instead of preventing the problem. And not even fixing the problem. Treating the symptom. Yeah, that's true. From not having. That's true. Right? Yeah. So if I can't sleep because I'm menopausal, what are you giving me? Ambien, Trazodone, Lunesta. Okay, people. And I've heard Ambien. Those are not without consequence for our bodies. Right. You know what I mean? How about a little progesterone? Yeah. I'm sleeping again. Oh my God. Oh, I sleep like a baby. So yeah, I mean, what a concept. I didn't have problems sleeping when I was 16. Yeah. I didn't have problems when I was in my 20s. So, we have this data and we're going by ranges that are based off of people who are older. I don't want a 55-year-old 53-year-old,
Oh, I don't either.
50-year-old range. I don't want that one. No,
I
it's
know.
not working.
No, I know my husband's always making fun of me. He's like, "Will you just be your age?" And I'm like, "No," because I see a lot of people my age, and they're just like, like so unhealthy and just not
5-10
active.
pills.
Yeah.
But medications, you know, I have patients on hormones and I have some supplements and everyone's like, I never took anything. I'm like, but you're only replacing what your body needs.
Right.
Okay?
Right.
You're trying to do, you need to think of it not as a medication, it's not a medication. You wouldn't stop putting oil in your car.
Right. Yeah. Exactly.
I got a brand new car. Oh, we can't put oil in it. It used it. It's done.
Well, I was shocked because I always thought I had high testosterone, right?
Mm-hmm.
And when I found out mine was low, I was like, what? And then also,
well, you might have had high testosterone when you were younger.
Maybe.
I mean, look at we have lower voices.
Yeah.
You know, if you stood me next to my sister, I have a lot easier propensity of gaining muscle. She always struggled.
I can gain muscle fast.
So my libido was always high. I mean, not till now do her and I even discuss that.
Mm-hmm.
But hers was always like, yeah, whatever.
Yeah.
And so I think there is some definite. There are a lot of us that do produce a lot more testosterone. PCOS, for example, polycystic ovarian syndrome patients, they produce a lot more testosterone, but a lot of it gets missed because those of us who worked out and took advantage of that didn't have the other side effects of PCOS. Right. And so it manifests differently in all of us. And testosterone is really important for females. I think it's shocking that a lot of not only providers, but I expect patients not so much, but providers don't realize that we make more testosterone. Females make more testosterone in our lifetime than we'll ever make estrogen.
Really?
Yeah. And people still say you don't need testosterone. That's a man hormone.
Yeah.
Okay.
Yeah.
But I make it.
Right. Yeah, exactly. Yeah. And I think that's what people think. They think testosterone is just men, right? And I think that's a lot of what the misconceptions are. Yeah, as far as that goes. Or they think if you take testosterone, you're gonna turn into a dude.
Yeah. You're gonna grow a penis.
I will tell you, I've been on it for a year now, and I'm still a girl. I'm still a lady. Which is okay. I'm still a lady. Hey, Paul, how are you? So Paul is your husband, and he's actually seen the benefits of therapy too.
Yeah, he's not my patient, but we both have kind of come through this journey together. We were kind of both at a spot in 2019, you know, and then COVID hit, right?
Yeah.
So was definitely a lockdown, and we had time to really kind of figure out what we were doing with each other. Mm-hmm. And I think it's really important that I think a lot of people feel that with aging, all your hormones drop, but also the intimacy, your ability to be intimate with your partner also drops, and you're thinking, well, this is the way life is supposed to be, and it's not. You can get that spark back. You should be able to. I mean, you're going to be empty nesters. Why not have
kids are gone? Mine aren't yet, but yours are.
But the point being is that I see a lot of actual divorces during this period because people think they're not in love, that they don't have that ba-ba boom anymore, and it has nothing to do with that. You're going to find someone else, and it's going to happen because you didn't fix the problem. Exactly. You have a side effect of not having your hormones balanced because they are a symphony. Not all of them are working together. I can't just give somebody testosterone and go, your libido's going to be great. No, in a female, her estradiol has to be optimal, her progesterone has to be optimal, and her testosterone. And most importantly, they have to be looked at regularly. You know, until you're in optimal ranges, you just don't get to put on a baseline of 0.1% cream and go on your way and never check. Yeah, because I've seen patients who are on women who are on an estradiol cream, and she's like, I still don't feel better. Yeah, because your levels are not there, and the person who's taking care of you is not checking. So when going back to couples, I think it's super important, and that's one of my favorite things to do is work with couples. Yeah. To see them really jam together again and kind of come together as a couple again and go, wow, I didn't think this was even possible. And you know, once you have that, you're both optimal. It's just super cool to see them working out together, being intimate, just regrowing that relationship like it should be, so that they age really nicely together instead of feeling like, well, we're married, we're stuck here, this is our life. But
Yes, I'm stuck with you. Because you guys have been married as long as
we've been
me and
together
Frank, or longer. I think you guys have been married
29 years, married 30,
Okay,
34
so
years
yeah,
together.
longer. Yeah.
So long.
Very long as time.
I still kind of like him.
Yeah, I mean, I guess he's okay. I'll keep him around. That's what I would tell Frank. I'll keep you around. Well, I think Felicia has a question here. Let's see. Felicia says, "Good morning, ladies. I think every woman should at least come chat with you. You learn so much about yourself and how to be your best game changer." I think she's seen you before. I think, yeah, Felicia Berg.
Can nor deny or agree.
Oh, that's right. But yeah, she's lost a lot of weight. Felicia Berg has lost a lot of weight. I've watched her journey, and she's really gotten healthy, and she feels good and confident about herself. So,
which is what we want to empower women
yeah,
to do,
right? Yeah,
because everyone's like, this is a fun fact. I just found this out from Sean McDaniel, my gym, my trainer. He says to me, "Did you know during the Christmas season people gain 8 pounds?
Me.
November, December, January." And then he says, the problem isn't those 8 pounds, is that next year you gain another 8.
Oh.
And then another 8. No, you're not going to.
Okay.
I'm making you accountable, girl. But the point being is like, it's kind of scary to think how that weight comes on in year over year. So and then you're in a struggle. But it also becomes more and more difficult to lose weight if your hormones aren't balanced.
Yeah.
And, they have to be in optimal ranges. Not normal ranges, and that's a key factor here. Mm-hmm. Normal is not what we're looking for. We want optimal, and optimal means still in normal ranges. But let's hypothetically say your testosterone, and I go back. Let's okay, we'll just make this up. Let's hypothetically say your testosterone is, no, let's use men. This is a better way because men have a really massive range. Men's testosterone range is 260 to 1100.
Damn.
It was changed in 2018, I believe, from 300 to 1100 to 260, so it came down. Okay. And the problem with these ranges, how do they do it? Well, they take, hypothetically, let's say men between the ages of 45 and 55, 100 of them, and they pull their labs, and that's in the range. The only guideline is that they can't be on medication.
Okay.
That doesn't tell me, do they work out? Are they obese?
Oh,
Are they? Do they eat a lot of processed food? Are they heavy IPA drinkers, which can increase estrogen levels in men?
IPA?
Yes, I know. I know. I'm going to get in trouble from the beer community.
Is that for women too?
Yeah.
Really?
It increases. But if you're in menopause, maybe you want your estrogen levels.
Yeah, right.
But the point I'm making is that these ranges are massive. And so a man might be at 268 and their doctor says your normal range for testosterone. Is he really? He's symptomatic, guys. So then for optimal in the wellness community, we want that above 600. Mm-hmm. And so he's still in normal range, but we want it above 600.
Right.
The other key factor is prostate protection happened when it was studied. It happened when patients, with men with testosterone levels greater than 300, not 260. Oh. So now we're putting our guys at risk for prostate health and inflammation. And so we really need to take the guidelines and the ranges a little bit, follow them, but really tailor them to each patient. Right. I'm not going to chase numbers. I don't just, if a guy comes in and he was at 280 and then we get him to 300 or 390 and he feels fantastic, leave him alone.
Right.
He doesn't have to be at that upper range.
Yeah.
We don't need to chase numbers. The goal is to tailor that to how you're feeling. What is your lifestyle? What are your goals? And what are you trying to plan with your life? What is it? Your quality of life. What are you trying to live?
Okay, that's awesome. And so once someone gets started on a program with you, do you see them every 6 months, every year? Does it depends on the client?
If you're postmenopausal or in menopause, mm-hmm. I like to see you every 3 to 4 months.
Okay.
Because we got to mess with making sure that you're in those optimal ranges. We're getting you into those optimal ranges, and we're seeing these fluctuations. Mm-hmm. And then after that, if you're in optimal ranges and feeling fantastic, and we get you teed in, then I could see you yearly.
Okay.
There's a lot of places here in town that do memberships. I don't do memberships. This thing is it's as expensive as,
Yeah.
as already
Yeah.
as it is.
But worth it.
I feel that patients should get what they pay for. If they come in and see me, they should pay. If they're not seeing me, why am I doing a membership? What is that all about?
Right.
Know your worth as a provider, and just do the right thing for patients so they can afford this.
Yeah.
That would be my suggestion. We don't need a membership to have you come in every 3 months and what, if somebody's I've been on hormones now since 2018. What could you possibly need? My levels have not changed.
Right.
So why do you need to see me every 3 months?
Yeah, that's a good point.
Now my levels were fluctuating and I wasn't feeling good. And no, I'm in optimal ranges for my estradiol. I'm in optimal ranges for my progesterone. My testosterone is optimal. There is no reason for somebody to check my labs every 3 months. We don't do that in the regular world for cholesterol and other stuff. Why are we doing that for hormones? We don't do that for kids.
Oh, yeah.
To check their hormones. So, once I get you teed in, if you're feeling fantastic, we can go to a yearly appointment.
Okay.
There's no, so that's kind of what I try to do is work it with that. Now, when ladies go through perimenopause, that's a struggle because
I think
things are fluctuating.
I think I'm starting that journey. I don't know. I'm pretty sure I am. I'm in denial. Frank says, good morning.
Good morning, Frank.
So do you have like a story, like a huge successful story? I mean, obviously you gotta, be confidential, but is there like a success story that you've seen in the last, since you've started this, that you want to talk about?
Oh, there's multiple.
Okay.
I mean, there's multiple success stories. I would say that the ones that are really dear and near are my polycystic ovarian syndrome patients that didn't know they had it. And when you optimize thyroid and progesterone, because PCOSers are not on, if they're younger, they're not on estrogen.
Mm-hmm.
They don't qualify. Good micronized progesterone, sorry. Migraines go away.
Oh.
Their fatigue goes away. Their weight gets improved.
Mm-hmm.
So yeah, there's adding spironolactone, for example, for acne and facial hair. The insulin resistance that PCOSers have. Unfortunately, the numbers aren't there, but we're insulin resistant. So we need to really nip that in the butt early on and not follow hemoglobin A1C and only just because of that. Right. And I don't necessarily mean using pharmaceuticals for insulin resistance. You can use berberine, teach them how to really dial in their diet and those types of things. And so I'll use local trainers, and I have a trainer out of Bozeman that I love. Her name is Pamela Sampson. Though using trainers that can kind of help patients understand their macros. It's money. We'll learn how to eat. So success stories, those are kind of my big ones. Mm-hmm. I can just use my own personal one. I had a full hysterectomy, so ovaries and everything out at the age of 40. Mm-hmm. I was first placed on Premarin, which was awful. I couldn't tolerate it at all. And that's a synthetic estrogen, pregnant mare's urine. In fact, that's where the Women's Health Initiative trials were made out of. Oh, okay. Came about. So that particular synthetic hormone I could not tolerate. So my provider put me on a combo estradiol, progesterone low. Well, it was not estradiol. It was estrogen, progesterone low dose birth control, and I did that until 2018. Mm-hmm. And anyone who knows me knows I'm a gym rat. I work out hard.
You've got like some bodybuilding
issues
too. This one.
And so I kept gaining weight, and by 2018 I was anywhere from 35, 45, 50 pounds. I just go fluctuate back and forth, and I couldn't lose it. Finally went to several providers and ended up in Bozeman with a provider who's retired now, who, by the way, is why I ended up here, because he told me how he got trained. And so that was how I found out that WorldLink Medical out of Utah taught and trained providers of all walks how to do hormones.
Nice.
And explain hormones. And it's all based off of science. This is not made up.
Yeah.
All of this stuff is study based. At any rate, he was the one that found out that my thyroid was not up to par, that I didn't have any estradiol, progesterone, obviously, and then testosterone. Once he balanced me, it took me about a year to lose the weight, mm-hmm. another year to gain my muscle composition back, and I've been this way now since then.
Wow.
And so I'm never going back.
Yeah.
I'm never. So, and here's the fact is, it's unfortunate that we blame estrogen as a cancer causer. It's not. Estrogen does not cause cancer. Okay. Estrogen,
We would all have cancer.
Exactly. Why aren't they taking our ovaries out? Let's go. I mean, we can't even get a doctor to pull our uteruses out, let alone. If it truly caused cancer, why aren't we doing it? And so,
oh, okay. Thank you, sir.
My handler. He is not my secretary. He's my handler. He is my handler. God knows.
Everybody needs a good handler.
Yeah. So, you know, by the time it was a journey, and it didn't happen overnight. And I think people need to understand that nothing we do happens overnight.
Right.
And once your hormones then finally become optimal, and we find where you feel your best, everything else clicks. You know. And so I lost the weight. Our intimacy grew. We're better than we've ever been. We're learning more about each other every day. Supporting each other, and that's what's really cool.
Yeah,
you know,
awesome.
I mean, we weren't meant to age. It's like that. You know, I think we just need to really understand what it is as far as how you want to age and what's the quality of life you want.
Right.
Yeah. And I'll take 3 years of good quality life. I'll take 6 months of quality of life over 20 years of shit.
Yeah. It's unfortunate. Like, I look at my mom, and you know, just watching her. I mean, she's not aging gracefully. Like,
oh yes, she is. That's what graceful is, girl. That's what they're talking about.
She's like 65, and she acts like she's 90. And it's like, I keep telling her, Mom, you have to go walk. You have to get active. She just sits around all day and doesn't do anything. And I'm like, and she can't move. She can't get in my car. And it's motivation for me, right? Because I'm like, okay, is this a genetic thing? Because I don't want this.
Right.
Like, you know what I mean?
Right,
Like,
no.
I want to be able to run and do stuff until I'm dead.
Right.
So I can't get around. Right. Until I don't have a pulse. You know, so it does have a lot to do with your lifestyle and mindset.
Yeah, 100%. But if you're so exhausted that you don't feel like you can do anything, this is where our parents are, right?
Right.
You know, I put my mom on hormones when she's 76 now, and I put her on hormones 2 years ago, and I won't be damned if I'm taking her off of them.
Really?
I will not go back.
Yeah.
No, I'm not taking her off.
You're seeing.
I mean, her cognitive function. I mean, she's old. I mean, you know what I mean, and she's been her life. I mean, I shouldn't say 75 to 76 years old, but you know what I mean. Like, she's meeting that peak, and I can see her decline in mental health, just being slower.
Yeah.
Right. But adding those things, even still, though she still has some forgetfulness, and of course it could have been a side effect from not having hormones for many years, because she had that history in her late 30s.
Oh, wow.
So, and nobody did anything then, and she had no her ovaries removed. So nothing happened from then to now.
Yeah.
So she's suffering the consequences of that, plus lifestyle changes. But
right.
I wouldn't take that back from her. I think she needs to be, and it has helped. You know, not the other day, it's been months, but she was on the floor with her grandbaby, and she would have never been able to do that and get up. She's got bilateral knees. No way.
Wow.
No way. So, you know, for protection of Alzheimer's, osteoporosis, cardiac disease, which is what the Women's Health Initiative trial was trying to study on sick women, and that's why that study is flawed. For people to extrapolate that one equals other, it's not true.
Right.
So people just need to really start asking questions, and it's unfortunate our primary providers don't get trained in this. I'm not saying that primary providers are wrong. No, that's not what we were trained. I mean, as a PA, I didn't get trained in this. Nurse practitioners that I talked to didn't get trained in hormone replacement therapy or wellness, and so this is a new field. We're learning, but it is our job as providers to start educating ourselves and really understand what's out there, because what we're telling patients is wrong. It's not true.
Yeah,
it's not true. I mean, they say testosterone causes heart attack and stroke. Men shouldn't be on it. Okay, wait a minute. They were born with it.
Yeah.
Let's flip this. Now let's try to take it even further. Men, there's a group of patients, women transitioning into men, but we're giving them large doses of testosterone. Why aren't they all dying of heart attack and stroke?
Yeah.
And it's safe to give a woman testosterone to trans to become a transgender, to transition, which, hey, I'm not saying that that's bad. That think that. What I'm saying is that the data is there.
Yeah.
We are giving her tenfold the amount of testosterone to become a guy. And that's fine. That is her choice or his choice now, right? The key here is why is it then that men can't have low dosages of testosterone, keeping them in normal ranges because it's going to cause them a heart attack and stroke.
Mm-hmm.
Doesn't make any sense.
No.
Think about it. Go the reverse. A man who wants to be a woman. Thought estrogen caused cancer. What are you going to give him to become a female?
Right.
Large doses of estrogen.
Yeah.
But I thought estrogen causes cancer. Men could get breast cancer.
Yeah.
We're not worried about them.
Right.
I thought it caused breast cancer. Where is the large community of men transitioning into women with breast cancer?
Yeah.
We're not seeing it.
Yeah. And you can skew data however you want it.
Very true.
Right.
Yeah. My host brother is worked for Eli Lilly, and he worked in the background of doing the science part, the studies.
Mm-hmm.
And he was very honest. He said, yeah, you can screw any data you want.
Oh, yeah.
You can make a study work for you any way you want it to. So be careful. Really pay attention.
Mm-hmm.
Really think about what they're telling you. And most importantly, please somebody tell me how hormones have been bad for us. But
we have them. We're born with them.
I'm not getting it. And so until somebody can prove that one to me, we're not doing it. Okay, I can say this though. Estrogen and progesterone, which are synthetic in that they're made like Premarin, pregnant mare's urine. This is made from a horse. She has way different estrogen than us. Okay, I can see where you could say, okay, well, that's probably not the healthiest formulation for us.
Sure.
Well, you could use estradiol and progesterone, which is what we use in wellness. And guess what? It's pretty safe. It's made from soy and yam.
Mm.
And so there are benefits to using a more natural formulation of hormones and it being safe. And so I just want somebody to please, if we want to get into a debate, tell me, show me the studies. I mean, even the Women's Health Initiative trial in 2017, they did the retrospective study on the females that they were testing. And what they were testing for was cardiovascular disease. Guess what? It did help with cardiovascular disease.
Crazy.
Their cholesterols were reversed. Vaginal dryness and urinating on themselves, reversed.
Mm-hmm.
Some of the women who were saying, I'm not here. I don't feel like I'm on a point. I'm forgetting things. If all of that showed reversal.
Mm-hmm.
So how is it that it's wrong for us?
Yeah.
I mean, the study, even though flawed, was a very good study.
Yeah.
And there was another retrospective study that just currently came out that said women on estrogen cream, which by the way, do not do any estrogens. We can do estradiol. And if you're worried about Big Pharma, you can get estradiol and progesterone by Big Pharma. Could decrease a woman's comorbidity rate by 19%. Wow. So I could decrease your risk of dying by all things by 19% by giving you a cream. Crazy. Why aren't we doing that?
Yeah. Sign me up.
I'm not getting, I don't understand that. So I think it's important people educate yourself, go out there. World Link Medical has a website for patients, it has a good portal. There are some wonderful people online, webinars, TikToks that you can kind of follow people and then learn more about those providers and just find what's best for you, what you're comfortable with.
Yeah. Do you have a TikTok channel?
No. I don't even like being on videos.
Really?
Mm-hmm.
And here you are.
Mm-hmm.
In the flesh.
In the flesh. Yeah.
So as far as testosterone, so say, you put a client on testosterone, there's different methods of taking testosterone. You want to speak on that?
Yeah. So in a female, there are 4 modalities that you can use. So what does that mean? There's a cream. I prefer to tell patients it's vaginal. So most of us in menopause, perimenopause are having problems with vaginal dryness. So it helps with that. It has good absorption rate there. So that's the cream formulation. Those are normally purchased through a compounding pharmacy. We have 2 here locally, and then I can order from any compounding pharmacy across the country. There's some in Florida, Texas, the Utah. MedQuest is one I use out of Utah because that's who I trade with. They're a great pharmacy, very regulated. So that's one way. Troches, normally vaginal as well. The reason for that is we have our submucosa and it can absorb quickly into the system. Oral formulations of testosterone have not really been well they just don't work well. Or otherwise, we would have had oral testosterone for men
Right.
many years ago. It just doesn't work because of the getting into the gut gets broken down in the gut, and our bodies don't absorb enough of it to make it worth you
The
consuming,
absorption,
right?
yeah.
So that's third way. There are oral troches for females that are supposed to go underneath our tongue. If I ever use them, I use them during a cycle. Like I've got a female who's still cycling. I don't prefer those. I just don't think they're as effective.
Right.
And that's based off of patients.
Yeah.
Right? Not because I used them. I've used everything except for anything oral. Myself, I've tried all of it, but I just I don't see that I'm getting good results with patients with oral troches. They're always still having complaints of low libido, ability to climax, muscle mass,
right.
Just not feeling up to par, fatigue still.
Right.
So that is not my favorite way. Then we have pellets. Pellets go subcutaneous into the glute here, and they absorb slowly. I normally tell my patients, if you want pellets, let's see how you're going to tolerate testosterone first. Pellets can work really well. I don't do pellets because I absorb them way too quickly.
Mm-hmm.
So and it's based off body type. So if you're somebody who, a runner, for example, a cyclist, I warn them that, yeah, you may absorb this very quickly, and be here sooner. So it becomes very expensive. Not only that, when you absorb it faster, you can end up with some of the side effects that you don't want from testosterone, which is facial hair and acne. And so that's why I'm not against pellets. I think they're fantastic when they work, and they work. All of these modalities are fantastic as long as you're being consistent and it works for you.
Right.
And then newer for me, and utilizing as far as I'm concerned, as a practitioner, is the injectable for females as well.
Oh, okay.
So if I have a couple and the male prefers injectable, a female can be on low dose injectable once weekly.
And that would be like a shot.
Intramuscular or subcutaneous testosterone.
Like how you would like with the semi-glute where it's in your stomach kind of thing. Okay.
Yeah, and those are the modalities. Key here is side effects. It's always low and slow, titrate low and slow so that you can see if a female is getting any facial hair or acne, so that we can address that accordingly, lower the dose, manipulate things. If you become prickly, here's the deal. It's very important that people understand this, especially in men. I get this a lot from wives. If my husband's on testosterone, is he going to become an asshole? But I can't make him an asshole. He's an asshole. He's going to become an asshole. So very important thing there. But if you're a more aggressive person, can you get more
aggressive?
More aggressive? Yeah.
Yep.
Okay, so spicy.
Spicy. I like it. What's wrong with spicy?
Yeah. So so that's kind of where I tell people. That's why low and slow with all the hormones are important. You don't want to bombard your system. Yeah, no, and then the other part, with hormones, you got to be careful because, like, I remember my first encounter with pellets. I was not aware of how I was going to react. Yeah, this was the first modality given to me. I was not really. I didn't know hormones. I'm learning at this stage, and so I get the pellets, and for the first time in my life, I felt sorry for a 16-year-old boy. Yeah, so you got to be careful, low and slow. Figure out how you're going to tolerate things. People need to understand what your body's going to go through. My libido was out of the room.
Yeah,
and we just got to.
You're like, I can't concentrate.
We got to reel it in here, and we got to do this properly.
Right.
So that's another thing with pellets and some of those things. You don't know how quickly somebody's going to absorb things. So be very cautious when you go those modalities. And there, like I said, I had no problems. I really liked being on them, and once but I just was really absorbing it too quickly, so it was not right for me.
Yeah.
But at least I can say I've done all of them, and I can go, this is the one thing this is my jam. This is where I like to be. So it works well.
That's awesome. I think we have a couple of comments here. We've got Jessica, success story here, lost 45 pounds, keeping it off.
Nice.
A1C is down and staying down. Cholesterol levels are now normal, no longer sluggish and tired every day. I feel so good. Can't wait to continue my journey with Stephanie. Aw, that's
Thanks.
awesome. And then Katie says, why is my provider only treating my symptoms and refusing to draw labs after I have asked several times?
Here's the deal. If I draw a lab and I am not comfortable treating what you have, I have to treat you. So they're not going to, that's the only thing I can think of why somebody would not draw your labs. I think it's not a good idea to be on anything and not be continually monitored.
Right.
Because the key here is if you still feel like crap, you're probably not in optimal ranges. And our providers in the lay world, if they have not been trained in hormones, don't realize that. They're like, well, we're going to give you a little bit, and this is what works, and this is the guidelines. Vaginal cream, 0.1%. Good luck.
Mm-hmm.
The other part of that I see a lot is a lot of providers are not doing progesterone. They're confusing progesterone with progestin. They are not the same beast. Progestions have been known to cause some cancers. So we have to be very cautious, but we also need to understand that they are not the same thing.
Yeah.
And so if you're only getting estradiol, we're born with all three things: testosterone, progesterone, and estradiol. We made them in our ovaries. The cascade's a little different for all how it functions, but we're not going to get into the logistics of how we produce it, but we make all three of them. And so to just give you one portion of those hormones is not going to be enough. It's not going to fix your symptoms. It might put a little Band-Aid on some of them, but everything needs to be harmonized, you know what I mean? And
it's all balance, right?
Balance.
Mm-hmm.
You should not be on estradiol alone without opposition of progesterone. We have breast, we have ovaries, we have a uterus. And some people who don't have their uteruses, there is a school of thought that you do not need progesterone to oppose it. That's wrong. We still have our ovaries, we still have our breasts. We need to oppose estradiol properly so that it balances and it doesn't get overproduced in our system and cause havoc.
Wow. Well, I'm glad that you know what you're doing, because I'm like, this is so intriguing. Like, because I always progesterone and progestin.
Just like estrogen.
Okay.
And estradiol.
Okay. Yeah.
These are more synthetic formulations. And when I say synthetic, we're still synthesizing estradiol and progesterone in a lab.
Yeah.
But when I say synthetic, it means it's been formulated. For example, like Premarin is formulated out of urine from a horse, right? Estradiol and progesterone have been formulated. They're broken down out of a plant, and Big Pharma can't patent a plant, so they're not going to push this for us. In fact, I just found it's all money. I just found out that from a patient that she was put on a combo pill of estradiol and progesterone. Hey, ding, ding, ding! Give one for the provider who did it. And number two, wow, Big Pharma's adding this, but that's the only way they can add it and patent it, because they're normally not found together. Okay, so now I can patent this drug because now they're together. The problem, it's very expensive and insurance won't cover it. Crazy. So just give her estradiol and progesterone. Big Pharma makes it, as well as compounding pharmacies.
Yeah.
So if you have a problem with, compounding pharmacies, I know that a lot of providers and pharmacists kind of say, well, that's a compounding pharmacy. They are not regulated. Yes, they are. They're more regulated than the regular pharmacy. Because they're compounding drugs. So if you don't follow regulation and sterility and all of those things, you're going to get closed down. They only produce medications and hormones and any drugs that has been approved by the FDA. So they're not making stuff up. Yeah. Okay. It has to be FDA approved. Now, don't get me wrong. I'm not all about the FDA. Not at all. But I'm just making a point that people sometimes it gets confused that it's not. Yeah. That they're not regulated.
Right. Yeah. I use the troches, and I just go to a local pharmacy here and pick it up. It's pretty easy.
Very easy and pretty affordable. I mean, you're thinking, if people want to know what testosterone run, if it's compounded, it's about $80, whether it's the troches or the cream. And if once we dial it in, you should be able to get about 120 days out of those things. So we might need to dial you if you're doing this monthly. We need to talk.
I am due for a checkup.
If you're doing injectable, that's about $45. Testosterone is pretty inexpensive. And that normally is every, I think the max that they really want you to use a vial is a month.
Mm-hmm.
But I suspect that there are clients that are not doing that because there's, as long as they keep it clean and sterile, I guess I'm not in their house.
Yeah.
All I can do is recommend the guidelines.
Right.
And then pellets, if you're a male, it's about $800 every 4 to 6 months. If you're a female, it's $400 every 4 to 6 months. So that's kind of the cost of testosterone. And I don't know about you, but I'm gonna die. I'm taking my hormones out of my cold dead hands.
Yeah. Give me my hormones. If they stop making hormones, I don't know what I'm gonna do. So
you and I are gonna be eating a lot of soy and yam.
Yeah. Oh my God. So as far as men go, are you seeing more men being more open to this?
We are. See, it's really interesting. Men, when they get their hormones, they're happy, right?
Yeah.
They learn about what their thing does. They are able to get erections.
Yeah.
Muscle mass. Their energy is improved. All of that.
Yeah.
So they're not really complaining at a young age. Us, the minute our hormones come in, you're like, I got to do this monthly. What?
Mm-hmm.
And we're roller coastering, and it's not as fun.
Right.
So then men don't complain, and then come around 30s, and then their 40s, and they start to notice a decline.
Yeah.
But again, who do they complain to, right? I mean, I think it took us several providers before somebody would even test, Paul.
Wow.
I mean, it was, no, we don't need to do that. Excuse me. Yeah, we do.
Mm-hmm.
Something's not right here.
Right.
I mean, so to say that's probably the biggest barrier I think men have is nobody's listening to them because they don't normally complain. And then there's the stigma and embarrassment. Well, my erections are not as good.
Mm-hmm.
I have low libido. I'm gaining weight. And so there's all of that goes with it too, which is total trajectory on a man. But more people are talking about it.
Yeah.
I mean, it's all, I mean, look at, what is that guy? RFK.
Oh, yes.
Look at RFK.
Oh my God. Like, how old is that man?
He's 70, I think.
And he's like, God, six-pack.
Yeah. So more men are saying we're not going to age like this anymore.
Yeah.
And that's how men should be.
Yeah.
There is no reason for men to continue with moodiness, depression, irritability, just fatigue all the time, not wanting to feel how he normally would feel, gets home and can't help around the house or just has no desire to do things.
Right.
And so then it becomes a roller coaster. They can get anxiety, they can get depression, then they get sick. Now, guess what? Your cholesterol's going up, your belly fat's going up, you're insulin resistant. Well, I wish I could go to the gym. I just have no desire. I don't want to do that.
Right.
And so it becomes the same kind of roller coaster that us females go through. And it's a cycle.
Mm-hmm.
And so then you have to really understand what your patient is coming in for. I mean, I've had guys come in and tell me, I went to see my doctor and I was telling them that, I just don't have any desire. I mean, I love my wife, but I just don't have any desire. And I said, well, what they do for you? Well, they gave me some Viagra. And I don't think he said that his penis didn't work. He said he has no desire. And so what are we doing here? You know what I mean? And so we really need to start listening to our patients. That he's not going to get the desire by using Viagra.
Right.
He's going to get good quality erection, but he's not going to get the desire.
Right.
And so
it's just a Band-Aid.
Exactly. We're fixing the symptom of lacking hormones.
Yeah.
The same when men don't have testosterone, they don't convert to estrogen. If they don't convert to estrogen, they have the same side effects that women do: increased cholesterol, Alzheimer's risk, osteoporosis, visceral fat increase, low libido, inability to have a good erection. All of these things happen to men as well. And so we really need to start listening to our patients instead of just going, no, you don't need that because I'm not comfortable doing it. How about you say, okay, you know what? I don't do hormones. There are several specialists in town that you can go to. And that's what I would recommend you do, but don't tell a guy that he doesn't need it and make him feel worse than he already feels, because you just counted his feelings.
Yeah.
And, and I've got guys that have come in as well that their testosterone was 267. I already told you the range was 260 to 1100. Yeah. And his provider said it's normal. He isn't on such the low end of the range. Yeah. He has prostate symptoms. He's not getting up to pee all the time. his erections are not good quality. So we could go through the gamut of what happens to a man as well. It's the same thing, and we really need to start listening to our patients, come up with a game plan for them that's best suits them, that's safe, and consistently educate our patients on what's best. You know, what are we gonna do? Why are we doing this? And where can we put you? Not where can we put you, but you know what I mean?
Yeah, not just here's a pill.
Here's a pill or whatever, and not test them anymore. The other thing, and with men, that there's 3 modalities as well, right? We talk pellets, injectable, and cream. So there are options for that as well.
To see. Okay. Okay, so we'll probably end it with this. So what are some simple, actionable steps listeners can take to start improving their hormonal health today?
Well, if you're young, we do know that exercising, HIIT, particularly, can assist in increasing testosterone levels naturally. Making sure you're staying away from processed foods, because that can also increase massive amounts of, not massive, but increase your estrogen levels, and not the good one.
Right. And I think that's the hardest part for people,
very hard,
especially people that are working all day and they're like, oh, whatever's easy, right?
Yeah. But we can do it. You know what I mean? Like,
Yeah.
You know, when you go home in the evenings, make a plan. Be like, okay, this is what dinner's going to be like, and I'm going to make enough dinner so I can take a plate for tomorrow. There's a few meal prep companies that we even have one locally. I've never used them.
Yeah, I heard about that.
But they, you know, what's it? 10 on meal prep?
Yeah, I think so. Because I was talking to Sarah Nelson with IV Nutrition, and I was like, I had no idea we had that.
Yeah, I hear they use local food, local growers and beef and whatever they're using in their products is all locally sourced. Thank you. So do a meal prep then. I mean, if you're going to McDonald's or some crappy fast food place, the meal prep is going to cost you what, maybe $10, $13?
Yeah.
You know, even if you just bought meal preps for lunch, start investing in yourself.
Yeah.
I mean, I think all of us are cool. We'll go out and buy a brand new car, pay $800 a month, $700, $600, whatever, but you won't spend any money on yourself to invest in this. You got to really start changing that trajectory of how you think about what's best for me and where am I going to go from here. Especially if you're not someone who's motivated or can't really get it together to prep, to get those meals done, to realize that, you know, you should be having at least half your body weight in water a day in ounces, you know, to make sure that your
water's the hard one.
Yeah, your protein intake is your weight.
Yes.
You know, and this is really hard for men, because men, if you're a 200-pound man and lean, you know, it's a lot of protein.
It's hard to get that.
You have to figure it out. You know, staying away from processed foods, fake sugars. You know, every time something says no sugar, there's a fake sugar.
Yes.
Look at the label.
Sucralose.
Garbage.
So sucralose. So I was on this big energy drink kick, right? Because I don't know why. I thought I needed it. I became addicted. And I'm like, oh, well, there's no sugar in it. And so on TikTok, people were talking about sucralose and how bad it is for you and everything. And they're talking about symptoms. And I'm like, oh, crap. I got to get off the energy drinks now. Like, that's not good for you.
No. So, yeah, you got to really start paying attention.
Yeah.
The U.S. does allow us to have really bad things in our food and approve it.
There's a lot of things that we have that are banned in other countries.
Yeah. Tons. I bet you sucralose.
Yeah.
No, erythritol.
Sucralose.
Real sugar. People never
Yeah.
bothered us before, but the minute we got diabetics, everyone thought, oh, sugar's bad. No,
sugar.
it's not the sugar.
Yeah.
No. Yeah, I don't know.
It's the chemical stuff.
It's everything chemical. Keep it out of your body. You know, if you're using oils, you want avocado, coconut oil, or olive oil. Get rid of the seed oils. They go through a rancid process, and then they bleach it. Great idea to eat. Put it in your body. You know, if you want to fry something, use avocado oil.
Right.
Coconut oil. It burns nicely, or heats up nicely.
Even for tacos. Really?
Mhm.
Okay. I'm trying to get my husband to stop using canola oil because
get that out of your mouth. Oh my God.
Like, what else can we fry these tacos?
Avocado oil. And he won't notice, and it doesn't have any flavor.
Okay.
At all. I don't. We could go on.
Yeah.
That could be a whole other session on food and what we put in our bodies, right? Yeah,
So basically diet, exercise.
just eat as clean as you can. I say
Yeah.
80 clean, 20 dirty.
Yeah.
You know what I mean? Just do your best, and don't stop making excuses.
Don't do a pumpkin cold brew with soft top for every day for a week. From Starbucks like I did. I told my husband, I was like, this is part why I gained 10 pounds because I was in Boston at a convention, right? And I was like, I need to pick me up. That was my mental, and I wasn't doing energy drinks. So I become addicted to these pumpkin cold brews with a soft top. Well, I finally looked it up the other day. 31 grams of sugar and like 21 grams of fat. And I'm like, no wonder. And I'm having one of those a day. I'm like, you idiot. It's like, I know
But they taste so
better.
good.
They do.
They taste so
They
good.
do. But I think that if you just balance it and moderate, like maybe one a month, right? Or,
Yeah,
you know,
that's
not
the
one a
20.
day.
That's the 20 dirty.
Not a one a day for a whole week. Don't do what I did. But so where can people find you? More information. I know you have a website.
We do morupwellness.com. You can also call us at 465-942092. That's the office number.
And you're on Instagram, Facebook.
I don't know.
I found you. You're on Instagram.
I am on Instagram.
You might not be active, but you're there.
I need to get a media person. Lord.
Yeah, you have Instagram, you have Facebook, you have your website, or call you to make an appointment.
Right, yeah.
to get
We're right
this
across the street from Wild Ginger in the Oliver Building on the second floor, 2702 Montana Avenue, Suite 201B. Yeah, I have had patients, new patients contact me through Facebook, and I try my best to get on there and look at messages, but I'm not very active on it. So
it's so hard.
It's very hard.
Like it's funny because like obviously I'm in real estate, and it's like I didn't think like when you get your real estate license you also have to become a social media marketer.
You better get your.
Jeez Louise, I have 2 jobs now. It's a lot. It's a lot. Jennifer says, "'Tis the season for eggnog. I love it, but it's so fattening and full of sugar." What would you say to that? Just have one once in a while.
I told you 8 pounds in this period.
You're gonna gain that 8 pounds with that eggnog, girl.
No. I'm with you. We have a drink called Coquito.
Yes.
And it's very it's.
Is that the one with the rum?
Yes.
Yes.
But it's not good. It's good, but not good.
I've had when I used to drink, I tried one once, and I was like, oh my god.
And you don't have to have it with the alcohol. You can not add.
Oh, you can.
Yeah, you don't have to have Bacardi in it, but it's gonna be just as bad as that pumpkin latte.
Yeah.
Thing.
Yeah. Maybe a one
Yeah.
in December.
Yeah, just have, Yeah.
Well, thank you so much, Stephanie. Stephanie is amazing.
Thank you.
When you talk to her, she's just real and down to earth, and you feel comfortable right away. So definitely hit her up if you are thinking about hormone therapy. See if it's something that would work for you.
Yeah. Just let us know.
Yeah.
We're here.
Awesome. Well,
Thanks for having
try not to gain those 8 pounds this December, and like me. But yeah, well, thank you guys for watching. Have a good weekend, and we'll see you soon. Bye. All right, we're gonna end on Instagram and bye Facebook. Takes a minute to end.